Welcome to your medical unit huddle for January 31st. Ooh, I was ready to hop in there. Through February 6th. I'm Ricky, your nurse manager. For patient experience this week, good job you guys on keeping our patient whiteboards up to date. You guys have been doing a stellar job with that. And then also keeping the rooms tidy, so good job with that, you guys. Just want to remind folks to make sure that you're doing your purposeful hourly rounding on our patients. Sometimes they don't know that that's what we're doing, but we want to make sure that we are rounding on our patients every hour, alternating with the staff members and that kind of thing, but making sure that that's getting done as well. For any patient who has an ileostomy or colostomy, they need to have a wound consult. So if you have a new patient that comes in with one, nurses, you have to order those wound consults. Even if during the assessment it looks like that ileostomy or colostomy looks okay, we want our wound care friends to be able to help us with making sure that the patient has a right appliance and that kind of thing on there. So make sure you guys are doing that. Also, we still are really not doing a great job with putting up the hazardous drug signs on the doors, and I don't know what or why that is happening. I know that it might seem silly when you think of like a Restasis eye drop being a hazardous drug, but those signs need to be on the door. So again, nurses, if you're giving it for the first time, it is your responsibility to make sure that that sign is on the door. And of course, if you're a nurse giving it thereafter, just making sure that again that the signage is on the door is very helpful. So please make sure that you guys are doing that. We also went live with any patient who expires. We are no longer doing the death packets, but there is a death documentation tab that you would add in Epic. And again, our house supervisor and chaplain friends will be able to help us with that. For any innovation this month, not necessarily this week in particular, but you should have gotten some education from Janet regarding the new AccuCheck machines. So in ULearn there is an education piece that you need to do, but there is a class, I believe the February 19th through the 25th, more of a hands-on, and then the go live will actually be February 27th. So be looking for that, or you should have that already. For our staff recognition and celebration, I want to give a shout out to Jessica Young and Michelle Benzer for being our employees of the month. So congratulate those folks when you see them. And of course, welcome to anyone new joining us or any of our float pool friends helping us out. We always appreciate you guys. I'm going to turn it over to your charge nurse for any current patient safety quality concerns. And as always, I encourage you to subscribe to our MCR Medical Unit YouTube channel, and you guys have a great shift.